Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with AC8, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's Ask Dr. Pane, the question we have comes from our Facebook audience. And the question is when to remove implants for best recovery. And a little more history on this question. Person has 345cc submuscular silicone implants that were put in about a year ago. They decided that they want them removed. And Dr. Pane, looks like is there a difference between removing them now or in the next 2 to 3 years? They're interested on recovery and what possible outcome they might receive. So, Dr. Pane, what would you suggest in this situation?
That's an interesting question. Now, basically, they don't want the implants in place. They've been there for a year. We don't know what they look like and how much tissue stretching has taken place. It's really not a big deal to taking them out now or waiting a couple of years, but the longer you wait, the more you're going to have some tissue changes from the stretching of the implant, maybe some sagging over the implants. Because the big question to me isn't the recovery. The recovery is going to be exactly the same. What could be different is the need for doing a mastopexy or tightening of the tissue the longer the implants are in place. That might be needed right now, but the longer you wait, the greater chance that that would be needed. Because in most cases, when you have an implant of that size for at least a year, and you take it out, you're going to be left with some degree of emptiness of the skin. Can't say it 100%. I'd have to see the person physically. But in most cases, that is what will be needed. Otherwise, you'll have some sagging tissue after the implant has been removed, which doesn't need to be addressed right away. Sometimes people will take the implants out, then they might come back later when they're ready to accept the scars that come with the breast lift and go ahead and do that. So not a big difference in the recovery, but potentially the need for more surgery to address the loose tissue the longer one waits before taking the implants out. If they want to get them out, just go ahead and get them out at this point. No real advantage no real difference in the recovery by waiting or doing it now.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Facebook page, Instagram, or Twitter. And Dr. Pane, we'll see you on the next question.
Great.